guys are going to do things as you normally would, whatever you guys are doing. I will tell you, the very first critical patient, I'm going to give it to 4-9. Guys, it's a grab and go. Grab the patient, take off. No IV, nothing. Just take off, get them to the hospital.
Today at UPMC East, we're doing the third of our Day in the Life scenario event, which is a simulated way for us to test what we will be doing and what things will feel like when we really open in 3 weeks and our patients are here. So it's a way for us to be very comfortable and familiar with our environment, our hospital, one another.
No, they're going to be calling individually with reports. So level 1's going to go to room 20.
As they come in, I'm going to go hang out by the door and see and sort of try to quick triage if they're coming in all at once. But if somebody gets sick, then we're going to have to need somebody else to get the door.
Once Dr. Van Fleet starts getting tied up with a sick patient, I'll go off and do the triage process.
Everybody, every single department, every employee is required to participate in Day in the Life. The extent varies. So we've had a team of folks that have worked together for months to really orchestrate and determine what our scenarios will be. Staff show up for work today and not really knowing exactly what's going to hit them, but it's all been very scripted behind the scenes. We've prioritized so we hit the most important scenarios, things that happen day in, day out, as well as the unexpected. So we have sort of a balance of both going on right now. And today in particular, what you see is the ED. You see a lot of activity in our emergency department.
The goal of this is to make sure that when our patients arrive on day 1, July 2nd, that they're as safe as they can be. So it's an opportunity really for staff to come together and work as a team, find out what issues we need to improve on, what can we do differently next time. And today, the reason it was so important was because we involved the outside community, the EMS community, as well as the STAT community with the helicopters.
We want to be able to allow the ambulance services to come in, drop off their patient, replenish their supplies, and be available to get back out on the road as quickly as possible. And we're looking at a target time of about 20 minutes. And utilizing the local services that will probably be our most frequent ambulance services here was one way that we felt would be the best way to test the process today. Really, I think that they felt that the ED staff and the registration staff were very cordial to them, were able to get their information quickly. They're very pleased at the layout of the ED, easy to see, easy to get around. As well as the idea that we had a lot of ambulances come in at one time, and there was still a lot more room in our ED entrance for the EMS agencies to enter as they would come in.
Probably the most important thing today is the way that we work together and develop our handoffs and our process flows working together. That can be very hard to practice unless everybody's all doing it at the same time.